Street-based outreach is a model that provides housing-based outreach services to individuals in public places. Workers actively engage people experiencing unsheltered homelessness and offer supports related to rehousing opportunities and services available through the homelessness response system. Street-based outreach ensures that service providers respond directly and immediately to a person where they are. Street-based outreach is a harm reduction approach that aims to provide a quality service by reducing the adverse effects of living outdoors. The primary goal of outreach when working with people who are sleeping rough is to assist people in accessing housing and supports dedicated to getting and maintaining housing. While engaging with people on rehousing and system navigation, outreach workers also ensure that unsheltered people have access to resources to reduce their health and wellness risks. In alignment with the Housing First philosophy, street outreach workers prioritize people who are experiencing chronic homelessness and demonstrate high levels of vulnerability. The distinguishing feature of street-based housing-focused outreach is its intent to work towards resolving homelessness by delivering services in an integrated response through collaboration with a range of services, essentially to expedite the rehousing and support process for unsheltered clients who identify their desire to be housed. It is helpful to distinguish the difference between outreach and inreach, and where these two types of client engagement occur. Outreach, when a dedicated housing-focused worker from an organization goes to a variety of outdoor locations including encampments, parked vehicles, tents, shelters not fit for human habitation, and various other public spaces to locate and meet with clients or potential clients that are experiencing homelessness wherever they are. Inreach, when a worker from an organization is mobile and goes into other agencies or fixed locations such as libraries, community centers, or coffee shops to meet with clients. Person-centered practice promotes customizing support provision to meet the needs of clients and people's inherent right to exercise choice and control over their lives, including the timing and process of exiting homelessness. Workers support clients in the care planning and decision-making activities involved in the journey back to housing stability and improved wellness. The following strategies support a person-centered approach: skilled outreach workers that respectfully engage with clients, assessment tools that link client needs to the best available service response, culturally appropriate responses, reintegration to family and community where safe and appropriate, timely engagement with individuals and interim supports while waiting for services, responses that focus on ending people's homelessness so that their health and wellness needs can be respectfully addressed from the safety and dignity of home. The practice model of housing-focused street outreach can be distinguished by 4 primary activities dedicated to ending someone's homelessness. 1. Information and referrals to drop-in, shelter, and rehousing services. 2. Assessment. 3. Direct services. 4. Advocacy. Within these 4 primary activities of the practice model, the core responses when delivering street-based outreach services include prevention and diversion protocols, referral to shelters and transitional housing, completing the common intake, the ISPDAT pre-screen, and common consents for the HIFIS and the by name and prioritization list, including Simcoe County Regional Housing First Program referrals, referral to housing with supports, assisted living, safety planning and harm reduction, referrals and access to basic needs, food, clothing, etc., connection to any other relevant services and supports as they get connected to housing supports. Together, we can and will end chronic homelessness in Simcoe County. Intentional and focused street outreach service provision will help us get there.